we saw the first group of about 34. That was those at the airport. At the time, we had sequenced about 66 community samples that were negative. Okay. The current one is giving us some Omicron in country. I think about 7 of them have been reported within the community sample, but that is to be expected because we are alerted as people enter, they are more likely, we may be having people who are incubating, so we have seen some now. But still, the leading variant is still the Delta among the community.
Okay, so you've talked about 66 communities. Earlier you said 34, but I was asking if we know how many exactly in terms of Omicron after the sequencing, because the earlier communication was 34. Has it increased? Do we know how many exactly?
The 34 was for the 116 at the traveler that was done. At that same time, we had done about 66 community samples, which were labs within country, and that's 0 for Omicron. The second batch, and I think about 40 or so, we have seen some Omicron in country.
And when you say that's a 7, so in addition to the 34, that's all?
That's what we know.
Okay.
That's what is recorded.
Okay. Well,
so as you go on to do your sequencing, you may find some. The most important thing is that it is in the community, and so that's what the caution for us to be more careful.
So are we chasing it? Do we know we are in control? 7, in which communities you would want to tell us?
The most important thing is that all the preventive measures that apply as to whether it is prevention through the mask wearing, hand washing, social distancing, they still work. Vaccines still work. Even though there is some evidence of some escape, it still works. So all the measures that we have still apply. So what we need to do is intensify it and make it more effective to prevent transmission from one person to another.